Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest today is Dr. Mahmoud Ghanem. He's here in this Health Supplier segment as professor and director of the Center for Medical Mycology at Case Western Reserve University and University Hospital's Cleveland Medical Center. And he's here to talk about Biome, the first probiotic to treat bad bacteria and fungi with good bacteria and fungi. Welcome to Health Professional Radio, Dr. Ghanem.
Thank you very much for having me.
Thank you. Now, what is Biome?
Biome is a new probiotic that we developed recently and launched in the U.S., which really intended to address the total digestive health. Mm-hmm. What differentiates this Biome from other probiotics available in the market is that most of what is available in the market, in fact, all address only the bacterial component of our microbiota. Remember, we need to have a balance in our gut of microorganisms so that we are healthy and we are really maintaining this health. So the issue, why did we develop Biome? Because in our gut, there is both bacteria and fungi. Mm-hmm. And to try to balance both of them, because they are important players in our health and wellness, we developed the Biome.
So how does a Biome actually enhance our gut function?
It does it in two ways. Number one, it is able to maintain the microbiota in our body. For our health, we should have a balance in our microbiota. Sometimes what happens because, for example, of the way of our diet, because of stress, because some people use some antibiotics, what happens, you have imbalance in what microorganisms in your gut. Biome comes and try to maintain this balance by encouraging the beneficial bacteria and fungus in our gut. In addition, it is able to really inhibit the growth of what we call digestive plaque. It's like the plaque in our teeth. You know, we brush our teeth every day to make sure we don't have any cavities. Mm-hmm. In the gut, sometimes bad bacteria and bad fungus come together to form this digestive plaque. Some have been shown to inhibit the formation of this plaque and therefore maintaining our health through balancing the microbiota, both bacteria and fungi, which are good for our system.
Now, you did some ground-breaking research and actually discovered this dual role of a healthy fungus that's in our gut. What type of reception has your discovery received from colleagues throughout the industry?
I thank you very much for asking this question. What we did a study trying to understand what are the microorganisms or bacteria and fungi that are present in our gut that are beneficial. At the same time, what others that are bad for us. And we focused on Crohn's disease patients, mm-hmm. and we were able to identify the bad bugs, as you would say. This work was published in a journal, which is a scientific journal, peer-reviewed. It's called MBio. And we were delighted to see that our peers, as well as people in the scientific field, found this is really a change in the way we think, because we are not only addressing bacteria, but also we were addressing the fungi. For many, many years, when people were looking at what are the organisms in our gut, they just focused on the bacterial component. This is in spite of the fact that we know for a very long time, in fact, from the 70s when I started to do my doctorate, we looked at people who take antibiotics, for example, and what happens, you kill the bad bacteria, but also you are killing the good bacteria. And this will give a chance for the fungi to flourish and overgrow, thereby causing this imbalance. And this was really not looked into until we started publishing our work and showing that this is very important point that needs to be taken into consideration, which is think fungus, as you may say.
As far as educating patients on this dual role of good and bad fungus, what efforts are you involved in to get the word out and raise awareness about this new research and this latest discovery?
I'm trying to convey this through multiple channels. One channel is through publishing our scientific papers, which are peer-reviewed to ensure that the high standard of our work. Also, I'm invited to give lectures at different scientific meetings to try to, again, show our findings and emphasize the point that having fungi in our body is really important for our health and wellness. In addition, I've been asked by a number of media, like yourself, to try to describe our discovery and show how it is important. So it is a number of different ways we are trying to educate the public about it.
And where can our listeners go and get more information about Biome and a little bit about your background as well?
First of all, you can, with respect to the Biome, you can go into www.biomehealth.com. This is a website which can describe what's the biome. Also, some of the studies that we showed that we are able to eliminate the digestive plaque. In addition, as far as my background is concerned, by going to the internet and searching, for example, PubMed or Google, put my name, put the microbiome, or put my name and publications, Gannum microbiome or Gannum fungal infections, and you are going to find a lot of my publications there, which can show the fact that I've been in this area for over 40 years and publishing similar work.
Great. Well, I appreciate you coming in and talking with us today, Doctor.
Thank you very much again, and I really appreciate you reaching out to me.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Mahmoud Ghanam. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.